One, hey, two, hey, one, hey, two, hey, three, hey, four, hey, ho, hey, ho, hey, ho, hey, ho. Everybody get up. Ho, hey, ho, hey, ho, hey, ho. Everybody get up.
From the dark side. And check out our new digs. This is Actors from the Dark Side. I'm LaDios Muhammad, actor with purpose. And I'm Rav'n, an actor with passion. We are so happy to be with you today. Today our topic is plastic surgery, and we're kind of delving into it from an actor's perspective, right?
Yeah.
Do you have to enhance yourself? Do you not? It's totally up to you, but I definitely want to know what my girl LaDios has to say about this.
Oh, so it can be really challenging in this field of work,
Right.
Getting older is inevitable. It's inevitable, and sometimes when you've been a mom, your body does not bounce back the way it did pre-baby. I am a firm believer of using plastic surgery as a last resort.
Yes.
However, I have experienced some plastic surgery. I've done some lipo and nip and tuck. I've done some cosmetic surgery where, I have braces. LASIK surgery, so I don't have to wear glasses all the time. Hence, I just found out I have to wear glasses to drive at night. But I think I don't see anything wrong with plastic surgery. What I do see wrong if you're doing it for all the wrong reasons.
Agreed.
Yeah.
Yeah, I'm with you there that it should be a last resort, that it shouldn't be done maybe in teens and those kind of things, and that you should probably give yourself a good couple of years to think about what you're going to do. I, like you, have been enhanced. I've had a few surgeries. I've had dental work done. And again, that was after, well, not the dental work, but that was after my children were born, kind of thing, when I did get my plastic surgery. But it was mostly because I didn't feel good about myself. And that at my core, it was like a hard deficit that I couldn't fix. With my teeth, I couldn't fix that. I can lose some pounds. I can, change my body in certain ways, but at the end of the day, there's certain things that I just am not going to be able to change.
Right.
And that's when I think plastic surgery can be helpful. The thing that I think is really scary, and it's so much that goes into our industry, is being judged on just first appearances and things like that, and the rush to get kind of altered and things like that amongst the younger generation and people that don't really do the research. What was your experience looking into doctors and things like that? What was your process?
So for me, I really, so I've always been in the health and wellness background, was a personal trainer, so losing weight was easy for me, and staying in shape. I used to run, so running was my thing, but I had broke my ankle one year and I had to have 2 surgeries and I couldn't run, and the weight just kept coming and coming, and changing the diet, doing everything I could to reduce that weight, and I just couldn't get it off. And so I had thought about it prior to that, but then because I had the baby marks, and I was like, well, I never could wear a bikini. But I was like, what does it matter? I mean, I didn't have the weight, so I didn't care. But as the weight came on, and then I started doing some research. My mother had enhancements as well. She had a breast lift, and when she was in her, she hit 50 or something like that. And a great doctor, great plastic surgeon female. Also, the same doctor did one of my hairstylists. She had enhancements as well, did an exceptional job. So I kind of did some background with her and then another doctor and did some comparisons and, you know, you go in for the consultations, you look at the work and you read all the side effects, what's going to happen. And then, you know, then you got to get your budget in because it's not cheap. Plastic surgery is not cheap.
No. I just paid my girls off.
I just paid off my tummy tuck last year, and that was like 4 years ago. Go figure. You know, so that's so funny. It's not cheap.
It's not.
And that's another thing is that, you know, saving up that money for this big thing or you know financing it. But I financed it through Care Credit.
Me too.
And you know, I maxed it out on that one surgery. You know, it was like almost like $8,000, $9,000.
Yeah.
But here's the thing: is you might feel good and look in your in your clothes, but I found out, which I didn't do the research, that when you get liposuction or tummy tuck in a certain area, there's no fat in that area, but the fat gets bigger in the other areas.
Oh, that's interesting.
Yeah, hence I still got a little belly.
Okay.
So you definitely got to do your research and understand, like, there's repercussions, there's also risk.
Yeah, yeah. I mean, even with like the boob job, you know, like I remember one of my friends saying, "When am I going to be comfortable with these things?" And I'm like, because you know, like, yeah, you still can't sleep on your tummy all the way. Like, you know, there's still certain things that it's like, oh, what are? And yeah, you got to deal with that. But at the end of the day, I know for me, like my experience was after 2 children and my daughter breastfeeding and all of that. That it was like, whoa, yeah, they were not good anymore. The milk went south.
They got that benefit of the breast milk. That was a great benefit.
They did. I gave them
It
the
was
benefit.
worth it.
And then it was like, okay, I'm done with these children. Now I need to feel good about me.
Yeah.
And I did that. But like you, I did a similar kind of research. A family member, also a very, very good friend of mine, had both used the same doctor. So they both gave me stellar referrals. And then going to the office was beautiful and professional and clean. And you know, and the doctor had a demeanor that let you know that he knew what he was doing, that he cared, you know, that he built a practice that he was proud of and that it was his excellence that was on the line. So you want to definitely do your research because the worst thing that could happen probably is to go and try to enhance yourself and end up disfigured.
That is super scary because I've seen some people who just did not look back to normal.
Yeah.
You know, I remember Mickey Rourke?
Oh, yeah.
And he was absolutely gorgeous pre-surgery.
He had such a rugged roughness that was like relatable and handsome in a big time way. Yeah. And then he changed himself.
And what about, what's her name? Jennifer, what was she on Ferris Bueller's Day Off?
Jennifer Grey.
Yes. And I loved her nose pre-surgery.
Yes.
And then she did that. But I mean, there's a plethora of people who've gotten,
that have gone too far, right? That too, right?
Yeah.
There's that woman, I can't remember her name, but she almost looks like a cat. Like
oh yes, they call her the cat.
Yeah, the cat.
And that, I think at that, what is that kind of like a dysmorphia phobia or something like that? It's like a disease or something like that.
They're not seeing things
They
clearly.
don't see things, you
like
know,
everybody else
we do.
Yeah.
But, you know, I mean, I am not anti-plastic surgery. You know, I may do a little more in the thing, you know, along the way, but I'm not about disfiguring my face, you know. Sometimes you have to get a good facial regimen, you know, to keep your face lubricated and, you know, but the pressures of Hollywood could really push you into a direction you may not want to go. Sometimes the pressures push people into being anorexic, you know, bulimic, nipping and tucking. That's why you see all these women, I can't stand this, they get these little teeny tiny waists and these butt implants.
Oh my God, isn't it ridiculous?
I looked at a Nelly video like last year, and it had like all these women in swimsuits, and they were all different shapes and sizes. Then I looked at like I can't think of his name. DJ Khaled. I looked at one of his videos, and like everybody looks the same. Tiny waist, big butt, big hips, and I'm like, there's no individuality because everybody's trying to look like Kim Kardashian, and I don't want to look like her, and I don't need the big, humongous eyelashes and the pumped up lips, and it's okay. Again, nothing's wrong with adding a little self-esteem. That's why we do it. But when you're doing it because you are absolutely either feeling pressured or insecure, then that's something you need to really question yourself about, because
I agree with that. Yeah, and you shouldn't be trying to change yourself on such a level that you are someone else, right? Again, embodying someone else and being like, oh, I need to look like Kim Kardashian or whoever you think is the hot thing. Like,
Little Kim.
Do you? Like, yeah, I mean, the way she enhanced herself was horrible.
She was beautiful. Beautiful. Even
now
after
she looks so weird.
So after her first surgery, she was beautiful still, but now I'm just like,
she did a Michael Jackson. I'm sorry,
I don't even
Michael Jackson.
Yeah, and I just wonder like what happened along the way, and some of that can stem from childhood experiences too. When people think or tell you, or bad relationships, somebody tells you you're ugly and you're trying to fit in. But again, I'm not anti, but there is so many debaucheries when it comes to plastic surgery. You just have to do your research, because you came across a video. It was like a few years old, but when I seen it, I was like,
this was terrible. I think her name was Dr. Boucher, and it was in Atlanta, Georgia. I think you can probably YouTube plastic surgeon rapping while doing surgery, and we'll provide a link. But oh my OMG. This woman was making a damn clown out of herself and her patient. And I felt so bad for the woman who recognized her body on that damn video being butchered while somebody was having fun.
Yeah, they were playing a hip-hop song called Cut It Up. Cut it. And then they had her stomach skin that they cut off of her dancing, and I was like, what?
Grotesque.
It was humiliating. It was humiliating. And again, that's unacceptable. I when I went into my to do my plastic surgery, the doctor's like, you have any requests? And I was like, do not be playing music during my surgery. Do not do a lot of talking other than the necessities. I like it really quiet, So I was really anal about that. Sometimes they'd be stopping for pizza. It was like, they stopped like, we gonna order some pizza. Is that right, Mr. King? They do surgeries where they stop for pizza. And they be eating it in the surgical room. And I'm like, what?
Damn.
That's crazy. So, it's just...
Sorry, I'll come back. Like, I just imagine, I'm just like, here I am alone, and you got the sausage and pepperoni on there. Fuck y'all.
It's just such a level of disrespect for your patient.
Yes, it's immoral.
And we're paying thousands of money.
That goes against the Hippocratic Oath, right?
Thank you. And but from my knowledge, on a follow-up, she's still practicing?
I think she got her license taken away. And here's one of the things where I'm like, okay, you are a little bit at fault, patients, because I do believe that she was a dermatologist, not an actual surgeon. And they were going in for a discount surgery, and that's what you gotta watch out for. If you're trying to go and get enhanced for $2,000 or less, don't be surprised if you get a cement instead of butt injections. You know what I'm saying? Like, and that happened. Somebody got cement put into their ass instead of real butt injection because they were working with a shiny.
But then that's because they're trying to cut costs.
Exactly.
And you might, if you're gonna pay for quality and do your research.
That's right. Go into the debt. Yeah. Take your 7 years to pay off whatever the hell it is.
You know. Mine was about 4, but 4 was too damn long for me. I was like, Lord, can this be over?
No, it was really 5. Yeah, it was 5 years.
It is. But you know, there's in any plastic surgeon. I was looking at there's this one plastic surgeon. He does YouTube videos, and it's for 90210, and he goes in, and one of them where this lady had incredibly enlarged breasts, and she was like hurting her back and her neck, and they had to like do a breast reduction.
Sure.
He goes into different, you know, like when there's good surgery and, you know, versus bad surgery. But he specifically says, and I'll put a link of one of his videos. I'm sorry, I just learned it yesterday, so I don't know his name offhand. But he definitely said the plastic surgery should truly be your last resort.
Yes.
You know, like if you were 300 pounds and you lost a lot of weight, then, you know, I can see doing a little nip and tucking, and, you know, because the skin is loose now, and
Yeah.
I can get, or you've gotten to a point where you went from a size 12 or something, or maybe a 14 to maybe a 9 or, you know, 8, and, you know, you just can't get those last little bit, and maybe a little bit of liposuction again.
Sure.
And I'm not here to say what you can and can't do is be, you know, love yourself about it, and make sure you do the research.
Sure.
You know, and understand there, you know, yeah, you get a tummy tuck, your tummy tuck looks great. You know, it looks great, but you got a scar now.
Yep.
You know what I'm saying?
Yep.
You got a scar now. And you better hope that they aligned it, that you can, it's below the bikini line.
Right, absolutely.
Which was that one lady's in the video.
Oh, that was terrible.
Her scar was
Her
well
scar.
above the bikini line. She could never hide.
And there were so
hide it.
many patients that were disfigured by that doctor. It was really sad.
And they never, oh my God.
It was really sad. It was really sad. So, yeah, and I just had a point that I was going to make in terms of, like, you know, if you're going to do it, just be prepared also for the fact that you might have regrets about whatever original state you were in. You know, I was born without the 2 teeth right next to my canines and my front teeth. So I had a really natural big gap. And now that I'm like at this place where I'm starting to do comedy and things like that, I'm like, oh my God, that fucking gap would have been so fucking cute. And it did make me look so cute, but I hated it. I hated it all through my childhood, all through my 20s. I thought people talked to me like I was an idiot. I felt like, you know, all of these different things, that it was something that I just had to fix. But now I'm like looking back, like, damn, that was who I was.
Yeah.
That's how I came into this world. And I'd say kudos to Hollywood right now for opening things up, that you do see actors that are not atypical, you know, supermodel gorgeous, and, you know, that you do have your Rebel Wilsons, and you do have people, and we are coming into this time where authentic, she did, but that's also just being healthy.
Yes.
That's also just saying, I want to stick around,
And
right?
that's what we're talking about.
So, you know, like, there is part of accepting yourself for whatever, but there's also, I don't want to have a heart attack at 40, that kind of thing too. But you know, it's just, you know, take yourself as you are, really love yourself, and again, like LaDios said, you know, when you do have to get enhanced, make sure that you're exploring every option and thinking about all of the things, including maybe watching a couple episodes of Botch, so you know what it looks like when it goes bad, like, you know, like,
The beautiful thing about acting is you're an individual. They don't want everybody to look the same
Cheers
way.
to that. Cheers to that.
You know, you want to be different. That's what makes you unique as an actor.
Yes.
Is what you bring to the table.
That's right. That's the greatest note to bring to the table. Absolutely. Is be you. Love you and bring that to everything, right? How can you be authentic? Like they say, one of my favorite quotes is being an actor is living truthfully in imaginary circumstances. And, you know, that's basically it. How would I react if I were beaten down by that man? How'd I react if somebody just stole from me? How'd I react? And if I can bring my reaction, my true self to that, that's what's going to get me booked, you know? That's what people want to see.
You don't want to look like everybody else doing it.
Booyah.
Booyah. So you got any more closing remarks?
Like I said, I think that's about it. Be you, love you, do you. This has been a great episode, I think.
So remember to get up and get out and do something for yourself. I'm LaDios Muhammad, actor with purpose.
And I'm Rav'n, an actor with passion.
And we are actors
from the dark side.